servants outpatient scheme is a scam. How do you expect a facility to provide optical dental referral and a refund for all lab imaging and drugs not available for shillings 204,000 with many dependents? So let's talk about the outpatient.
Yes.
Yes, how is it functioning?
You see, with the outpatient, we rolled it out 2 years ago with the civil servants scheme. Previously, the civil servants used to get what is called medical allowances.
Yes.
In their payslip. Then the government says, we stop this whatever medical allowances, and we give NHIF money to, you know, take care of the system. And we accredited some hospitals to be able to see our patients. Now, we've had challenges when we began the scheme, but it is now slowly picking up. We have challenges, as you mentioned, about the dental. We have challenges about the optical because of the pricing. Currently, we are now doing an actuarial study to find out how much do we actually need to pay for those others.
Some of these things are beauty. They're not medical.
Well, but you see,
I could want to look nice and I'm a servant. I want glasses.
No. We don't.
I want some.
But it has to be the recommendation of a doctor.
Yes, of course. We don't. No, my friend. We don't cover, you know, beauty.
Luxurious
plastic surgeries. Your doctor must actually see you're almost getting blind or something like that, my friend. Or you. No. We, of course, we are very thorough. We have a whole department that looks at the benefits.
Yes.
We also have doctors in the institution. We have, you know, so it's not just anybody who comes up.
Okay. Another question from somebody. First, can somebody enroll? Is there an age limit to enrollment? If you're 60, can you enroll somebody 60?
No, not financial. This is a national scheme.
So anybody living can be enrolled on NHIF?
Yes. No, you know, the only problem we have is what we call advanced selection. And this is the challenge that has been in the informal sector.
Yes.
That people come to NHIF when they're ailing.
Yes.
You look at your dad or something like that and you say, let me now make him a member of NHIF. And then you begin utilizing immediately.
Yes.
You see? Normally we say after you pay, and then after 3 months is when you can we can activate
you can benefit from the card.
But some people are ready to. But since this is a social scheme, we don't mind. We will have to go. But there is no age limit. In fact, what some governors have done, they have set aside money to pay for the poor, for the elderly, and the orphans. Some of them have said, like the governor in Kisii announced last time, that anybody in his county who is 65 years and above will be registered with NHIF, get an NHIF card, and when you're admitted, NHIF will take care of it.
NHIF has not been having a very good reputation in the past.
I know.
I know you've been there less than a year, 1 year.
1.5 years now?
I do not know whether that image, that perception
is that behind you now?
Yeah, it is behind. That is why I can walk tall. That's why I can appear here. And I think you can ask Kenyans. There was really a time when you don't want to be associated with NHIF.
Yes.
But no, now I think my officers walk tall. They can be able to go even to shopping malls, and they don't get harassed. There was a time, every time you pass around and you are told you carry down money, you are not treating our people. But I am happy, at least, because Kenyans have been criticizing us for the right reasons, that possibly we do not become transparent enough. Like last year when we printed, you know, our annual returns, and the Kenyans were able to see. We also showed how much we paid these facilities, both in the civil servant scheme and in the national scheme, and people could really realize these hospitals have been getting a lot of money.
There was a controversy over your proposal to build a hospital. And I think the Minister of Health was objecting. And then architects or the people, the consultants, are still demanding the money. I don't know whether that matter has been settled.
We've not settled, but this is historical. And we are addressing that. We are addressing that.
In what way? You must pay the consultant.
I don't know. What we are trying to do is consult with the mother ministries and treasury and the relevant government agencies so that we can see how amicable that solutions can be done.
The people, you know, and I'm seeing some feedback that it takes a long time for NHIF to pay.
Sure.
The hospitals. One example here is Chogoria. He said that it takes so long, which might make hospitals turn away or be hesitant to take your cards. They want cash.
Yes.
What is the period within which you settle the claims from hospitals?
We actually have a customer, an agreement with our hospitals that within 14 days after the invoicing, we pay. Unless, of course, there's been a particular problem in one hospital. Say that, like one of Chogoria, maybe because we have to audit and first of all find out, you know, some of them exaggerate.
Right.
The normal.
They can also cook fish.
Yeah, they can also.
Yeah, I wanted to talk about that. How claims, fraudulence in hospitals, either government or whatever.
Yes.
How serious is the problem?
It was very serious before we automated our systems, but automation has really assisted us. What happens now, you go to hospital, you give out your card, and it is hidden, and it is relayed to our database that this patient of yours has been admitted on this date and is being attended to. Then my staff within that locality, that branch, will visit the hospitals and look at, you know, the people, our patients who are there, and then looking also at the charges. Mind you, we have the coding of the diseases, and we know how much does it cost to treat malaria, to treat this particular thing. But the fraudulent claims have not gone.
Yes.
We cannot say that they have gone. A big challenge is sometimes they forget to, you know, to check out. So a patient is admitted for 3-4 days, and we are billed for him to have stayed there for 10 days or something like that. Yeah.
Is it true that somebody is alleging that NHIF only pays for bed and not doctors and medication? Maybe you need to make that straight.
No.
Because you spoke about that.
No. Let's make very clear.
What are the card cover? One more
NHIF,
time.
NHIF comprehensive care covers for consultation, for that doctor's fee. It covers also for medicines that you're given in that hospital. That is hospital, group category A and B. Category C, we then pay the rebates. We don't talk about the bed.
I think that needs to be clear to the people out there. That
let it be clear. The bed
for
story,
public hospitals and mission of faith hospitals.
Yes, it's comprehensive.
But the other private hospitals is where you only cover
a rebate. We have an agreed rebate.
Yes.
But we are not telling them.
It's not just bed only, even
bed.
in the private hospitals.
Yes.
If I go to Nairobi Hospital, expensive hospital.
Yes.
How much you are saying it's a rebate, but
we
there's
rebate them at 2,000 to 2,500. So, but we have not said this is for the bed. I don't know how much they will.
But that is below bed, because at Nairobi Hospital bed it would be 3,500 or 4,500.
Yes.
So you are even not covering the bed alone, leave alone medication and the other consultation fees.
Yes, these are some of the enhanced rates that we want to get.
Okay.
And the bigger the pool, and that's why I'm requesting Kenyans to come in large numbers, not only here in Nairobi, but wherever they are, so that, you know, insurance is about pooling.
Yes.
The more we are, you know,
the cheaper
the better.
It is to provide for.
Yeah. You know, the healthy will take care of the sick, the young will take care of the old, the rich will take care of the poor. Yeah. And we forget this Kenyan story of, I've not been sick for the last 1 year.
So
can you give
me back my money? Why should I be insured?
Oh, yeah, or others have been writing to say that NHIF should have some incentive, that anybody who has taken care of himself for more than a year or so without but I normally tell them that even when you insure your motor vehicle, we hardly come and tell you, my friend, you have not caused an accident for 2 years or so.
There are people who, there are penalties for non-payment.
Yes.
Monthly payments. Somebody
yes.
says that is a disincentive. Because somebody will somehow forget, or it will get by, this month you didn't remit your 160.
Yes.
Penalties?
That is where the catch is. It's a big problem because the Act states that you pay 500% of the penalty of what you had not paid. And we took an amendment to Parliament, and Parliament had passed, but we have not passed the law yet to bring it to 25%, because it was really a disincentive. But then, you know, this was specifically for the formal sector. Because it is the employer. It's the employer who deducts. So some of them had a tendency of deducting your money, and they don't remit it to NHIF. And they trade with it. But then when we now move to the informal sector, I think we have to have some kind of human face.
Right.
But that's not to say delay your remittances.
Yeah.
Because it will also affect.
Okay. Means people have to be disciplined to get the service.
Yes.
There should be no excuse.
Yes.
Right? Pay if you need the service.
Yes.
Question, when are you planning to expand the outpatient of a facility on the NHIF card?
There is a session of paper which we've done, and the ministry is, you know, looking at it, and then it will be presented to Parliament. Because a healthcare facility, I mean, healthcare provision is a very expensive issue. You remember at one time in 2004, 2005, there was the Ngilu bill.
Yes.
Which passed, and it never got the presidential.
The president rejected.
Yes, yes. So we don't want this one to also be rejected. We want to really see how much a Kenyan will pay, how much will the government pay. You know, once we roll out universal healthcare, we are saying you walk in, you walk out of the hospital. And then it is going to be very expensive. First of all, we have to look at those facilities. Are they able, if we give them those money, because likely we are going to the capitation way. Capitation is a system where we pay you in advance, and we tell you the following people are the ones that you'll be treating. So, you know, when you give hospitals money and so there's a bigger challenge. I am looking forward to a day when I'll come here and tell you now we have rolled it out.
With the NHIF being there,
yes.
Why is this in this country? Every weekend there is Harambee for medical.
Because people have not become NHIF members. In fact, I was telling some, you know, Weshimiwas, especially the governors, tell people, before I come to your Harambee, I should only come to Harambee to top up what NHIF has not been able to pay. But because people have not taken cover, that's why there is Harambees all the day, all the time. Yeah, we either go outside or even local facilities. If you go to the rural areas where government hospitals give comprehensive services, the NHIF members go there, get treated, and they go home. Others are left, and some Kenyans think it's the government that's discriminating people. It isn't. It isn't really.
Is there any way you can, as an organization, since you receive, you are the one sending customer to hospital?
Yes.
How do you ensure that a hospital gets the facilities, that the doctor is there, the nurse is there, and the medicine is there? Is there any way you can do that?